did you start working as a dentist?
My first job as a dentist was in New York. I graduated from NYU School of College of Dentistry. In New York, you're required to do 1 year residency in order to practice. So after finishing that 1 year of residency in a hospital, I decided to become a chief resident, stay a second year, because we could do anything that we wanted to. And I wanted to promote my surgical abilities. I was able to do sinus elevations, implant placements, and I spent that whole year, which was the best year of my life, in the hospital training. And during that year, I also worked in a private practice because I was allowed to do it. So I shared my time between hospital and working on real patients out there.
Can you share a memorable patient case that taught you valuable lessons as a dentist?
I think there are a few. You always remember the ones that maybe didn't go so well. I think it starts basic. It's hard to single out, one, but it starts from being able to talk less and listen more to what patients say, be quiet, and have them talk more, tell you what they're expecting, because I think the main reason why something may not go, even though it might be beautifully done in terms of, because, dentistry work, if you take an x-ray, everything looks perfect, and some patients still may be unhappy because what they imagine as an outcome was not aligned with what we deliver, even though it's perfectly good outcome, if you look at the guidelines. So having the ability to listen carefully and take in, what they have to say and make sure to speak to the lab. Let's say if it's a cosmetic case, if it's an implant case, we want to make sure that if someone's expecting to have, 16 teeth on the top, we can deliver that to them and not end at 10. So it's one of those things that, aligning those expectations usually fix issues that we may face, down the line. So that's I realized that, after a few cases.